They say the child is in good condition, but apparently has no history of recent travel. Now, many cases that we've been seeing are in patients over the age of 65. So we need to clear up some more information about this virus, and we're going to find out from the source herself. Joining me now from Kind Health Group is Dr. Georgine Nanos. Welcome back.
Thanks, Ginger.
You've been so helpful because we really need the medical side, not just our speculation. So right off the bat, 65 and up, underlying conditions. We know that's the concern, but how about 10 and younger, 5 and younger, 3 and younger?
So up to this point, what we've seen from all the evidence that we have so far, and again, this is a very fluid situation, it's changing day to day, but we have seen that the COVID-19 is not affecting children to the extent that it does, that the flu does, for example. People may still get sick, and even healthy people will obviously get COVID-19, and some of those people will be children, but we're not seeing some of the very severe outcomes that children with the flu sometimes get. So, but the worry is that children, even though they may not get those severe symptoms, and same with other healthy adults, you can still transmit the virus to people who are vulnerable, and that's why all of these containment measures are in place now to stop it from spreading or at least slow it down.
Can you transmit the virus even if you have no symptoms and it doesn't actually take hold within you?
Yes, because it's a very long incubation period. It's from anywhere from 2 to 14 days. And so you could be infected with the virus and not show symptoms for quite a while, sometimes 3, 4, even up to the 14th day potentially. So that's where all of this worry is that people who are asymptomatic, showing no signs at all, are carrying the virus and infecting other people. And that's why we're so adamant about these containment measures right now. And because we have such a big vulnerable population in our country, people over 65, lots of chronic diseases, that we want to protect those people.
All right, the testing kits have been a major focus in the last couple of days. We need more. But I'd like to find out, medically speaking, who should get tested? Is it everyone at this point, or anybody who's symptomatic, period?
It's neither of those. It's symptomatic and who meet certain clinical criteria. So right now we just do not have enough tests to go around. That's just the honest truth. And a lot of the hospitals will have some tests, and private clinics and doctors' offices have some tests, but not we definitely don't have enough to test everybody, or even people who are symptomatic. So we want to reserve those tests for people who are at highest risk and may need critical care. So if you have a mild case, if you have any kind of upper respiratory symptoms, do not think that you're going to get tested. You can call your doctor's office. It'd probably be better to email them if you can, because they're now being overwhelmed with phone calls. Don't go to the ER. Don't walk into your doctor's office. If you can manage at home, that's what we want everyone to do. If you have mild or moderate symptoms, no severe underlying conditions, and you can manage at home, then that's what we are recommending everyone to do right now.
But the facts are that over half of the people that's had it have recovered from it.
Yes.
Which is something that I think is key to get out there.
Right. Most people are going, as I've said many times, most people who are healthy are going to recover fine. So we want to save those tests and those critical care hospital beds and the emergency room beds for people who are going to need them most. We just don't have the resources in our healthcare infrastructure to overwhelm the hospitals with people who don't need that level of care.
Can we build up our immunities? Because I know a lot of people say echinacea, vitamin C. Can we build up our immunities against the coronavirus?
No. Sorry,
I know, because you do this all day. You were telling me you answer the phone all day.
What we can do is stay as healthy as possible by eating well, continuing to eat healthy foods, exercising outside, socially practicing social distancing, so that you're not, when you're working out, you're not in like small groups, but you can, or larger groups, I should say, and being careful if you choose to go to the gym, that you're being very careful about wiping down equipment. But overall, go outside, exercise, do the things that are going to normally keep you healthy and sane. But all of these herbal supplements and none of that's going to make a bit of difference right now. Hand washing is where it's at.
Now, hand washing, I know because we've spoken to you a couple times this week. Number one, antibacterial wipes for your areas, at work or even at home, your car, your phone. What if you don't? I mean, we're running low on all this stuff. What if there are no antibacterial wipes? Is Windex or soap and water anything?
Soap and water is first and foremost, your best defense, just plain old soap and water is better. It's actually better than hand sanitizing, and hand sanitizing is actually second to soap and water. So the best way to decontaminate your hands is with soap and water first and foremost. So that's what we should optimally do, but obviously you can't always be near a sink and soap and water. So that's where hand sanitizer is the second.
In the whole transmission thing, though, what about if you're at a drive-through restaurant and somebody's packaging up your food, can they actually put something on a piece of paper and I transmit it to you, and then you contract it from that paper?
Theoretically, yes. So,
but that's not really the main concern.
Yeah, I mean, anytime you're coming in contact with someone at this point in where we are in all of this, you want to try to minimize that contact, be able to wash your hands or wipe them off in any way possible. And at the very least, if you can't do that, don't touch your face.
And remember that the majority of the folks, over half, are going to recover from this and be healthy.
Way more than half.
Way more than half. All right. You always calm the fears, and you get the facts out there from a medical perspective,
Happy
which is so
to help.
key.
And I've been saying it all day long. I know it's easy to say don't panic, but we really want to try to calm the public hysteria, because that's going to be a bigger problem, and already is at this point. So just do what you can.
All right. Dr. Nanos says don't panic. Logan, over to you.